So how about the labor,
Yes.
delivery, and postpartum?
Okay, so with labor and delivery, I've worked on hundreds of pregnant women. I haven't been in hundreds of births because that is their choice of who they want. That is a very personal choice, who you want in on the delivery, labor and delivery of your baby. But when I have been there, and what we teach, so I do teach craniosacral therapy for the 𝐓𝐿𝐥𝐿 Institute, and I teach the conception, pregnancy, birth course for that. So what we teach is that labor itself is a parasympathetic activity. You know, when we think about our autonomic nervous system, we have our sympathetic system, which is our fight or flight or mobilization or get out and do things, part of our autonomic nervous system. And then our parasympathetic system is more the rest and digest, more metabolic function, right? And so labor, pushing a baby out, really is a parasympathetic function. But what happens is we get increased sympathetic tone because it is intense. There's no getting around the fact that it's an intense experience. I'm not discounting that in any way. So, but we have made it a little bit more in that fight or flight range of our autonomic nervous system function than it needs to be. And so what happens then when the sympathetic tone goes up, parasympathetic function goes down, right? It's inhibited. We know that just as how that functions physiologically. So with craniosacral therapy, we can come in and facilitate rebalancing that autonomic nervous system function so that the sympathetic tone comes down, parasympathetic function can come back up, and the normal process of delivering this baby can occur in a more efficient, more natural way. We have a technique that we call the still point, that we induce a still point. And really what that does is help to rebalance the autonomic nervous system, bring parasympathetic function back up, lower sympathetic tone. And so that can be a huge benefit during labor. Again, our goal isn't to have a really fast labor because that can be just as traumatic to mom and baby as a really prolonged labor, but we want it to be efficient and what's just right for that mom and baby. So by keeping them in that more parasympathetic state, we can facilitate that. I didn't mention this when we were talking about pregnancy, but the other thing that we can do is really help empower mom and baby together with that communication to come up with what they want their birth experience to look like. So whether they want to be, and again, there's different settings for birth. So I'm going to say some things that may or may not apply to certain settings, but you can kind of generalize it across all settings. But it may be that mom and baby think birthing in the tub would be helpful. So you can talk to them about that. And so if you are invited into someone's labor, be helping to be an advocate, like telling the midwife, the OB, the labor nursing staff, you know what, she'd love to get into the tub right now, and help her with that. Or knowing how to help her change positions so she can labor in different positions that are more effective with gravity assisting her rather than laying flat on her back in the bed. So we can talk with mom and baby throughout the whole pregnancy about what they would like their birth to look like or include, or if possible, again, every birth plan is subject to something not going the way we want it to. And we work with that. And you help mom be prepared for that. But when you're actually in the labor, helping her remember, oh, you know what, maybe we should try hands and knees position or side lying, or let's go walk. Come on, I'm going to walk with you. And you can be doing still points as you walk with them, or you can release their sacrum. One thing that we find is really, there's not a lot of clinical research on this, but there seems to be a correlation between certain cranial bones and certain pelvic bones. So for example, the temporal bones tend to mimic what the ilia are doing. And so say baby just seems to be getting stuck. It feels like the ilia are not widening the way they need to in order for a baby's head to come through the birth canal. So you might want to come up and mobilize the temporal bones and see if you can get some ilial movement happening through working the temporal bones. We call that the balancing act, where you're working the cranial part of the body to help release the pelvis. And that can be really helpful during labor and delivery as well. Once baby has been born, we mom, baby, dad, partners, whoever is there, that family unit, we want to give them some time to recover, to bond. That skin-to-skin contact with baby right next to mom is so critical. And there is Dr. Raylene Phillips out of Loma Linda University Hospital System in California wrote a research paper on what she called the golden hour, where we just don't want to mess with them. That first introduction between mom and baby on the outside and dad or partner, whoever is there, is so vital. And it is critical. Nothing, eye drops, checking the weight, all of those things are not as important as that first hour of contact between mom and baby. So we really want to educate mom about that, help encourage staff to give that to them if it's possible. Again, recognizing sometimes baby needs some care right away. And so you have to do that. But at Dr. Phillips Hospital in Loma Linda, she actually they reconstructed the birthing suite so that if baby needed some kind of intervention, there was a window that they could take the baby out of the birthing room to do whatever they need to do, but their goal was to get that baby back to mom in 7 minutes or less.